and welcome to our presentation. Today we are going to discuss a disease which is also called silent disease because it gradually weakens bones without obvious symptoms until fracture occurs. Millions of people worldwide, particularly older adults and postmenopausal women, are affected by this condition, making awareness, early diagnosis, and preventive care essential. The disease under discussion is osteoporosis. Osteoporosis is defined as reduction in strength of bone that leads to skeletal fragility and fractures. Most common among the postmenopausal women, but 30% of the fragility fractures may also occur in men. While talking about the mechanism of development of osteoporosis, there are many inducing factors and there are some possible mechanisms of development of osteoporosis, which includes apoptosis, inflammatory reaction, autophagy, non-coding RNA, DNA methylation, which leads to decreased osteoblast and osteocyte activity and increased osteoclast activity, leading to development of osteoporotic bone, which becomes prone to fractures. There are many risk factors which may be divided into non-modifiable and potentially modifiable risk factors for the development of osteoporosis. Non-modifiable risk factors include personal history of fractures as an adult, history of fracture in first degree relative, female gender, advanced age, white race, and dementia, while potentially modifiable risk factors include current cigarette smoking, estrogen deficiency, early menopause, which means less than 45 years of age, bilateral oophorectomy, prolonged premenstrual amenorrhea, mostly more than 1 year, poor nutrition, especially low calcium and vitamin D intake, may also lead to development of osteoporosis. Alcoholism, impaired eyesight despite adequate correction, recurrent falls, inadequate physical activity, and poor health and frailty also leads to development of osteoporosis. There may be no signs and symptoms associated with osteoporosis until fracture occurs, giving it the name of silent disease. Usual system symptoms include back pain, loss of height, spinal deformities, and protruding abdomen. While investigating the osteoporosis, the most important investigation is measurement of bone mineral density. The T-score less than 2 minus 2.5 is indicative of osteoporosis, while the risk measurement scores, which includes FRAX, OST, or score, which usually indicate the 10-year probability of experience of fracture or risk of osteoporosis for patients based on current weight and age, and other factors which are considered are prior estrogen use, race, and fracture history. Also include the risk measurement of osteoporosis. As osteoporosis is a disease of older adults and postmenopausal women, so its early detection is necessary to manage it promptly. As the symptoms occur or there are fractures in the old age, will indicate the consultation of a doctor for the best management of osteoporosis. Thank you very much.